Hi guys, it's Janae with Daily Dental Hygiene, and I'm going to be talking about bleeding and how to not normalize bleeding. How many patients have you had on a daily basis that say they're a bleeder? They bleed every time. Every time I brush and floss, I've always been a bleeder. I've always been a bleeder. Yeah, I don't floss because I always bleed. We have got to break this chain of normalizing gingival bleeding. It's not normal. And this is how I talk to my patients. When they say I'm a bleeder, oh yeah, cavities are genetic. Oh yeah, everyone in my mouth has dentures by 50. We have got to get on track and stop normalizing these types of behaviors because they're not normal. I tell patients your mouth is no different than any part of the body. It's all tissue. It has blood, it has bone, it has all these things that are exactly just like the rest of your body. Now, if your arm spontaneously bled, would you freak out? Yes. If your eyeball started bleeding? Yes. If I took floss and rubbed it along your arm, would you start gushing blood and profusely bleeding? No. Can you imagine if you did? Why is it that patients, if any other part of their body spontaneously bled, they'd be in the emergency room, but their gums are just spontaneously different? It's this whole mindset that the mouth is not connected to the rest of the body. Okay, that ends now, today, with you, with me, with every patient. And I explain that to every patient. If I were to take this floss and put it anywhere against your body, would it bleed? No. Your mouth is no different. Anytime that I'm flossing, anytime you are bleeding, anytime you are brushing, that is a sign of infection. If you saw that there was blood coming from your foot, you damaged your foot. There is an infection. There is something that needs to be removed. Your mouth is no different. The more you remove from those gums, the bleeding will subside. So tell your patients, the more they floss, the more they brush, the more that inflammation, infection, and gingivitis will go away. But please, get this notion out of patients' heads that they are just bleeders. They're not, unless they're on blood thinners. Like they have legit prescriptions for blood thinners that might increase their susceptibility to bleeding, which most people are not. Stop normalizing this. This is the same thing with cavities. People are just, my mom has bad teeth. My grandma has bad teeth. I have cavities. They're genetic. No, they're not. Bleeding is not genetic. Flossing and brushing is not genetic. It's the steps you take on a daily basis. So please explain this to patients. A lot of them have just lived their life for 40 years as bleeders and have not been educated on otherwise. So be the dental hygienist that does. Take care, guys, and have a great day.